Good afternoon. This is Mike Poore, Superintendent of Little Rock Schools. It is actually Friday, 2 o'clock in the afternoon. You know, we told all of you that we would provide an update no later than early this weekend and no later than Sunday, but we decided to push that up a little bit, mainly because we've got a plan or a known course of action that we want to take as we head into next week. Please understand that the decisions that I'm going to share with you right now were done in consultation with our Department of Health and also with the Department of Education. We very much appreciate both of those entities being involved, so much so that the Department of Health actually sent over, they were going to send one person on Wednesday to help us with tracking and tracing. They ended up sending two, and those two have stayed now for 3 straight days, and we even added one additional person on. Says a lot about our Department of Health in terms of them seeing the caseload that we have in this district and responding and supporting, and we appreciate it. After consulting with these 3 entities, working with my own team, we are going to go ahead and make a decision to extend the virtual learning platform for all pre-K through 12 students through Tuesday. So Monday and Tuesday will be virtual learning for the district. Now, a couple things that we want to share about that. We expect students and staff to be engaged with their learning, and we expect to have a normal day, meaning that students, you're going to interact with your teachers throughout the day. If you're in elementary, high school, and middle school, you're going to go through your course schedule throughout the day, and the teachers will guide you so that they can make sure things get taken care of. We also know that many of you have had some challenges sometimes with posting the homework and the activities that are a part of that instructional day. We're going to extend the time so that you have greater flexibility of when you put your lesson in and making it so that you can do it later in the day. And all that will come out with additional information to both parents and to students through Schoology and through your individual teachers. As we go through, we also want to make sure that parents, that you understand that we have food service provided. This week, we kind of went with a hybrid model of only having one location. Next week, we look like we are going to have, we hopefully will have 6 different locations. What you're going to need to do is you're going to need to call your school cafeteria to provide a count so that we know how many need meals. That will then let you know where you can then go pick up those meals, but we'll have them spread throughout the city. As you call in for your meal, you'll need to have your student ID number so that we can get an accurate count, and then we will provide the meal service between 10 and 11:30 on both Monday and Tuesday. Students will be given lunch and then breakfast for the next day. So you can start to make your calls in even for next week as soon as probably this afternoon if you'd like. It's probably important to think then too about our employee groups. Teachers, our largest group really of employees, you will still work from home and providing lessons. We're doing that to mitigate risk of exposure for you so that you are able to work from your home environment. That also, when you talk about working from home, includes library media specialists, it includes counselors, school psych, and that type of employee group. Others, we're going to have principals and administrators all report to their schools, secretaries report to their schools, food service, you will return to work. A couple employee groups that will not be at their work site are transportation, you will not work Monday or Tuesday, and security guards that are less than 12-month employees won't come to work Monday or Tuesday. Nurses, you will continue the activities that you have had over these last 2 days. Some of you are working from home, some are working at the school site. You need to work that out with your supervisor. Nurses, again, we appreciate everything you've done to help us with contact tracing. The other things that I would like to share with you is that when you think about us coming back, and the reason we're looking at Wednesday being the next day of how we make decisions, is we want to bring students back as soon as we possibly can. We want to do it safely. We want to do it in guidance with the Department of Health and our Department of Ed. And my guess is that next week on Wednesday, my sincere hope is that we will be able to bring back multiple school campuses. But something you all have to take into account. Right now, even with all these folks work on contact tracing and receiving the calls, in the queue, we still get larger and larger numbers. So we can't ever get the caseload eliminated and minimalized so that we know exactly what we're dealing with. That actually shares how quickly this virus of Omicron is spreading. And that's why we all need to take advantage of the things that we do have at our disposal. That's mask, that's social distancing, not getting in large group settings. That's all of us getting vaccinated, because that's the ultimate thing that can help create a healthier environment. If you look at this, you know, the Secretary of Health, Dr. Romero, said that we could get up to 20,000 cases by the end of next week. Right now, last night, we got up around the 8,000 range. So just imagine, we still have some ways to go on this, and we're going to all have to work together. Please, parents, staff, understand we're working to get ready for next week. We hope to bring kids back. We also have the Ready for Learn team, led by Dr. McGee, preparing for what the spring looks like. So we're not just looking short term, but we're also looking long term. Again, we want to have kid normalcy, kid activities, things that we most love and enjoy being possible deliverables to you all in the spring. Proms, end of the year banquets, events that occur in classrooms. We want those things to occur, and we want to figure out the right way to do it. We have parents, medical advice, teachers, all working together to plan that out as we go towards the end of the spring. I'm looking down at my notes just to see if there's anything else that I missed, and I did miss one other category. I think it's important that we do everything we can as we bring schools back, and more will be said about this when we come back next week, but we need to mitigate as many things as we possibly can to limit exposure. So there are several things we're going to do. We are going to ask that mask compliance, which we've had in place, extend out, at least for this short period of time while cases are spiking, even out into the outdoors area. I don't think that's going to be a challenge because the weather is cooler. I think that's going to be okay. We did that well a year ago at this time. We also are going to ask our administrators to work on lunches and breakfast so that we can do as much of keeping kids separated as possible. That might mean even having some meals brought into classrooms if necessary. And then with our pre-K group, we're going to be looking at trying to have them keep in pods. The smaller the group, the better. And that limits then, you know, what contact exposure they may have if there is a positive case. One final thing is we are under a new set of rules as of yesterday about 2 o'clock, which is that the quarantine or time period that you need to have if you have tested positive now is down to a 5-day period. So that is coming through our Department of Health. That now is an action that the state has. We will be in compliance with that. That also will shrink some of the times we have to deal with employees and everything. It's another good reason why Wednesday's kind of a good date to look towards, because we'll have gone through this first phase of employees being out. We can better understand where our workforce will be on Wednesday. Bottom line, hey, we still got to take care of one another right now. This is a challenging period. If some of you don't think that this is serious, go check out the hospital rates rising. We still have deaths increasing in this state. And you could say that there's less severity with Omicron. True, but there is that many more people having it, which enhances the risk for health for many others. We have our hospitals that are just, I mean, I'm working so hard to try to keep everything moving and going. They have their own cases. Let's all go jump in and help by doing the right things over and over and over. Wear your mask, keep your social distancing down. We appreciate everyone's efforts, because I really believe this is a power of us moment where we've all had to work together. It's been a shift again that we've all had to go through. Appreciate that from parents, appreciate what students are doing, and appreciate our staff. Thank you so much, and I hope you all have a safe weekend.